Good afternoon. Welcome to Medical Grand Rounds. I'm Bob Wachter, Chair of the department. The usual ground rules are up here. If you have questions, type in the Q&A, closed captions available. And if you're interested in CME, please stay on at the end. We will get you the instructions and the barcode. Special announcement as a continued return toward normal. We will begin in-person Grand Rounds on April 14th. Our new site for in-person Grand Rounds, and I hope to see many of you in person, is in the ground floor of the remodeled Clinical Sciences building at Parnassus. Beautiful, beautiful new lecture hall. Lunch will be served. There will be a computer access to Apex there and all those sorts of things. It will be a hybrid, and that will be our plan going forward. So we will be broadcasting it while also doing it live, and this will all be one big experiment, as are many things. But look forward to seeing many of you in person on April 14th. This is a special week in the department, one in which we celebrate our Master Clinicians in the Department of Medicine. In a usual year, our clinicians provide extraordinary care to hundreds of thousands of patients in settings that range from primary care offices to homes to intensive care units. Today, our clinicians will see thousands of patients, doing everything from sensitively informing patients of difficult diagnoses to prescribing cutting-edge therapeutics to coordinating care across multiple diseases and specialties, both in the inpatient and outpatient setting. For a long time, I think we've done a good job celebrating our researchers who publish groundbreaking articles and get big grants. A reasonable job, I think, of celebrating our educators who teach our trainees, but probably less than we should to celebrate our clinicians who do extraordinary work every day and extraordinarily hard work, and particularly over the last couple of years, doing that through the circumstances that we've all have lived with is just is breathtaking. So I want to thank all of you for what you do every day. The department, now 14 years ago, established the Master Clinicians program to honor members of the faculty who were distinguished by their commitment to clinical medicine and their superb clinical skills. Master Clinicians are sought out by peers and trainees for their diagnostic reasoning, clinical skills, and desire to acquire and share new knowledge, as well as their ability to provide compassionate and equitable care to our patients. These are the doctors' doctors. And so this week is really in part to celebrate our Master Clinicians. The program is now led by my colleague, Lakshmi Santosh, and we are accepting nominations for this coming group of Master Clinicians. The nominations are due April 1st. If you have someone who you think is a Master Clinician, please go up on the website and think about submitting a nomination. We are celebrating this week folks who were selected last year. Because of COVID, we missed 1 year of this week of celebration. So just to highlight them, Nicole Appelle in General Internal Medicine at UCSF Health, Cam Ashbaugh in Infectious Diseases at UCSF Health, Soraya Azari in General Medicine at the County, and Kerry in Nephrology at UCSF Health are the 4 Master Clinicians who were selected in 2021, and look forward to meeting with them tonight at dinner, and also to celebrating for however many 3 or 4 new people for next year. So congratulations to these exceptional physicians, and thank you again to all the clinicians in our department. 3 years ago, through a very generous gift of an anonymous, actually 2 anonymous donors, we established the Gurpreet Dhaliwal Lectureship, designed to celebrate and hear from a faculty member who exemplifies the qualities that we look for in Master Clinicians, really a capstone to this these days of celebrating our Master Clinicians and all of our clinicians. Just to make clear, and I know Gurpreet was quite worried about this, the Gurpreet is alive and well, but the donors felt that he was someone quite worthy of this honor to have a lectureship in his name, and anyone who knows Gurpreet knows that that is absolutely true. This year's Dhaliwal lecturer is Aimee Zaas, Professor of Medicine at Duke University. Aimee completed med school at Northwestern, residency and chief residency at Hopkins, did an ID fellowship at Duke, and then joined the faculty there in the Division of Infectious Diseases as well as International Health. Aimee's had a distinguished career as a clinician, educator, someone who works in clinical research, but probably best known for serving as the program director for Duke's Internal Medicine Residency program since 2011. That means we compete with her every year, and that's hard to do because she's, by all accounts, incredibly skilled at her role. She works with the education team in her Department of Medicine to ensure the best possible educational environment for their residents. She mentors the residents' faculty. She also is chair of their Diversity, Equity, Inclusion, and Anti-Racism Education Subcommittee of the department, and chair of the Survey and Scholarship Committee for the Association of Program Directors in Internal Medicine. So Aimee is a national leader in medical education and in clinical medicine. She's with us for a couple of days, meeting with our clinicians, educators, and many of our trainees. And we are grateful to her, and it's actually just great fun to have visiting professors come onto campus again, as it should be. So Aimee, please come on, and we look forward to hearing your talk today, which is entitled There Is an I in Team, Stories of Investment, Inflections, that is inflections, not infections, inflections, introspection, incompleteness, inspiration, and intentionality. Aimee, thanks so much.
Thank you so much. I'm just working on sharing my screen here. Thank you so much, Dr. Wachter, for that kind introduction. It's always a little bit hard to hear an introduction about yourself, and you're like, wow, did I do all those things? And I could not be more excited or more grateful to be able to spend time with you all here at UCSF. I've brought in my virtual background. As you know, it's a little bit cloudy today, but I assume that this is what it would look like outside of my window on some other different day here. And so I can't thank you all enough for this incredible opportunity. It's been fantastic so far, and certainly should continue to be so. So objectives today, and I am incredibly grateful to be here in person. And I know that while this lecture is on Zoom, we are all getting used to, again, reconnecting on personal levels. And I was just having lunch with Dr. Murad, and someone stopped by, and they were so excited just to see a colleague in person. And so there are a lot of invitations in this talk. And for everyone who's listening, no matter if you're just starting out as a student or you're in your early career, if you're in that very challenging mid-career space where you're trying to figure out what your next is, or if you're nearing the latter parts of your career, throughout this talk, I invite you to reflect on the lessons that you have learned so far from people who have been important to you in your time, from the patients that you have cared for, and the colleagues that you have interacted with. I also hope over the course of the time we have together to help inspire your future plans as you think about where you've made an impact so far and where you hope to make an impact in the future. And again, definitely playing on the fact that we are all fortunately getting to be together so much more than we have been over the past several years. And even soon we might be able to get together without masks on our faces. I hope that the topics in this talk really help initiate conversations among mentors and mentees who know each other, among future pairs of mentors and mentees, and among colleagues and confidants at all levels. So first things first, I think it's important, again, as we are all reconnecting, that when you're meeting someone who is giving you, and you're taking your time for an hour to listen to whatever pearls of wisdom that they might have to offer, that you actually get to know those individuals as more than a talking head on a screen, but actually get to know them as the 360-degree person that they are. And I will admit for sure that there is a hidden curriculum here that I want to take out of the shadows, because I really believe that in all of the work we do, whether it is working with students on our teams, working with consultants who we're sharing the care of a patient, even though we might not know them well, or working with the various people who help us do our jobs every day in the hospitals and in the clinics and in the classrooms and in our labs, getting to know them as the actual people they are is one of the antidotes to the stress and the busyness and the frustrations and the fatigue that can often set in as we go about trying to do the right things in our careers and in our daily lives. So each picture on here tells some part of my story. I did not put in a picture of myself as a young child, but I am from the Midwest, so I grew up with sort of that middle America, kind of thing, very, suburban life. I was a medical student actually at Northwestern with Gurpreet Dhaliwal, and have admired him ever since that time. I am a wife to another physician who is also busy in a leadership role. We are parents to two children, two boys who are now 16 and 18, and I am also a parent to two dogs as well as two cats. So it is generally constant chaos at the Zaas house at all times. We are incredibly passionate Duke basketball fans, and you can see us here in the bottom, it's the bottom left corner of the screen, celebrating our younger son's bar mitzvah party at Cameron Indoor Stadium. I feel incredibly fortunate to be sharing the city of San Francisco with our beloved Blue Devils who are playing tonight, and I certainly hope that their stay here ends up being longer than mine so that they can participate in the Elite Eight this coming up weekend. I am a frequenter of the sideline of soccer fields, and at any given moment, you can see me hopefully not screaming at a ref, but cheering my children on as they pursue the thing they love the most. We could not have managed our lives throughout the years of our kids growing up without other people helping us, including a series of absolutely fantastic au pairs, one of whom is pictured here, who helped us grow our family over time. And I now feel like I have 8 or 10 daughters, throughout Europe, who spent quality time with our family across the years. We do like to keep ourselves in shape by going for runs and going on trips and going hiking and doing all of those sorts of things. I wouldn't have been invited here, I don't think, if I weren't a physician and an educator. And so I spend a great deal of my time serving in that role as a program director, a job that I absolutely love tremendously, and will take anyone down if they don't agree that it is the best job in the entire world. Being a program director certainly involves being a clinician and being an educator, but also being a mentor and being a cheerleader and doing generally all sorts of ridiculous things in order to keep morale up during the challenging times that our trainees are facing on a day-to-day basis. I will say that one thing that worked for our family with the busy work life that we have is integrating our children into what we do. And so you can see here at the bottom of the screen, one of my very favorite pictures of all time, which are my kids on the sideline. They're on opposing teams for our VA versus Duke annual residency football game, the Turkey Bowl. I'm not sure if they're sharing strategies or if Jake, my older son, is actually telling Jonah to have the VA Jets, do something wrong so that his team can win. But regardless, this picture really integrates, work and home for me in a very special way. In addition to that, our family has had the opportunity to be patients. And you can see up here, this is nearly 5 years ago when my husband was undergoing a bone marrow transplant with our son Jake as the donor. So we know what it's like to be on the other side of this fence as well. I will also say that when Gurpreet invited me or reached out to see if I would take the invitation, which of course I would, to be the Gurpreet Dhaliwal Visiting Professor during your Master Clinician Week, he shared with me the history of who had served in this role before. And when I learned that I would be doing a talk following the remarkable Dr. Kimberly Manning, I would say that also, including all the I's in my talk, I was definitely a bit intimidated. But with that, let's get started. I'm going to give you a bit of the prequel, some of the themes and things that I have learned over time that I hope to illustrate with stories throughout the talk. But this, for those of you with a shorter attention span, this is the TLDR, or the too long, don't read, sort of the crux of the talk is shown right here. And this is how I have learned over time to frame what I do with my time, that I am given, so that I feel like I am best fulfilling the mission that I have. Your career is something that is long, and I truly believe that is a good thing. I think we can all attest that our careers are one part of what makes us ourselves, but certainly not all. And you can go throughout the literature and the podcasts and the conversations and find so many things about how to achieve some sort of ever elusive work and life balance. And I subscribe to the individuals who actually have challenged that assumption and said, gosh, when you think about it as balance, it often means that things are out of sorts, and it can feel like you're constantly struggling to do what is right by you and by the people that are entrusted to you. And so I like to think about finding who you're supposed to be in this life that we have, and figuring out what might allow for you to have longevity, not just in your career, but also in your other interests, in your relationships. What is going to keep you sustained during the long haul? When things get challenging, when they become unexpectedly difficult, when you have triumphs and others. And so for me, I like to think about it as, well, what are things that I value? How can I maximize the things that I value in the time that I spend? And there's a series of questions here that you might consider. And I would never say that these are all of the questions you might consider about what you value, but as you make assessments about how you spend your time, do you value living near your family? Do you value living closer to work so that you're spending less time commuting and more time doing or being with the people that you want to be with? Is it important for you to be seen for who you are and to be included in decisions and how things are run? Do you need to be spending time actually growing and not trying to be someone that you're not? Do you value being somewhere where you can learn how to say no and actually give other responsibilities to others? Do you need time to reflect and decompress? Particularly important for me was being able to find role models and individuals that I really respected and that I liked, and who could give me honest answers about things I was thinking about and choices that I was making, and set examples for me that I hope to follow. So in many traditions, and including traditions at Duke and at Hopkins and here, Grand Rounds often begins with a case. And so our case today starts out with a 27-year-old intern who presented to internship quite undifferentiated in what she might want to do in the future, but if asked, would admit to saying that she wanted an academic career, although if truth were told, it was not entirely clear that she knew what that meant. Review of systems was positive for moderate overall anxiety, as well as moderate to severe excitement about the future. And possibly it was actually moderate to severe anxiety, but as memory serves, at least we'll go with moderate. Exam was notable for complete career illiteracy. Fast forwarding through the 3 years of residency, this intern recognized that she wanted to pursue a fellowship in transplant infectious diseases and was going on to do that following residency training. But otherwise, aside from this clinical passion, she had acute career paralysis because it was coming up that you needed to do something during the research portion of a fellowship so that one could grow this academic career. And at the time, it was going to be clinical research, something that seemed interesting, but perhaps not quite as passionate about as she could have been, but that was the way that it was going to go. But you will see throughout the talk, as we relate stories, there is a part of what happens to us that has a lot of serendipity. And as it happens, this particular intern to fellow, to resident to fellow is clearly me. And I happened to attend a Grand Rounds that I had not originally intended on going to, but showed up to a Grand Rounds that was being given by a basic scientist in the pulmonary division. And he was talking about how the innate immune system had a role in the development of environmental asthma. And in this particular discussion, there's a slide that I can still vividly picture to this day. The slide had no words on it, and it was this giant fruit fly that was no longer living, and it was covered with Aspergillus hyphae. And as the story goes from Dr. Schwartz's talk, deletion of innate immune components in Drosophila lead them to be highly susceptible to exoskeletal aspergillosis, I suppose. And you can follow through mouse models and into humans how polymorphisms in the same part of the innate immune system led to differential sensitivity to environmental fungi and differential susceptibility to environmental asthma. I can promise you that this was not something that I was interested in when I walked into that talk. But somehow during that, there was a spark that was struck. And I remember thinking, this is so interesting. These flies, in mice are susceptible to the allergic effects of Aspergillus. I wonder if there's something that's happening in the transplant patients where these same differences in innate immunity might lead one individual to be more susceptible to aspergillosis than others. And a series of conversations happened throughout that. And I had the luxury of having a chief resident year where I had time and growth to explore and actually set forth a plan that I was going to take this leap of faith and enter a basic science laboratory and try to answer these questions that we had come up with. And this is where the eye of investment in the team really comes to play. Because as these plans were being laid, it seemed like such a great idea. And I had an entire year to put together the grants and the questions and what I was going to do. But when I returned from my chief year and entered the lab, that was a time again of sheer panic because I had no idea what I was doing. I knew I had no idea what I was doing. And while I didn't have the words at the time to really know what imposter phenomenon was, clearly that was what was happening, as I was sure this was going to be the time that they were going to figure out I didn't know what I was doing and I would need to stop and go and find and do something else. That's not what happened. And it happened differently because of the investment from mentors. The people who are shown on this slide, John and Barbara and David, they said, it's okay, we get it. We know you don't know what you're doing. We want you to show up with your ideas and a work ethic. And our investment, our knowledge of how to support you and to take someone who has that idea and that work ethic and help you turn it into career, that is what your responsibility is. Be here, let us help you. And I will tell you that having investment like that, having mentors that believe in you at that exact time that you least believe you can do whatever it is you said you were going to do, that is the most powerful motivator. And so I really had no choice, and show up I did, and I worked to build a career as an early physician scientist. And it wasn't easy, and I will not trouble you or bore you with the many stories of laboratory mishaps that occurred in that early part of me figuring it out. But eventually we began to have, what is considered the currencies of success in the laboratory environment, with interesting results and abstracts and papers and more grants. And there I was following that classic pathway, first on an institutional KL2, and then with my own NIH funding with a K23. And it was at that time that our children were born. And I just want to pause and recognize, what was, in the rearview mirror, happy chaos, but oftentimes more chaos than not. And take a moment to recognize anyone who is happening to be listening to this talk, who is in their early career and trying to build themselves into who they want to become here at UCSF, and also figure out what it's like perhaps to be in that early part of family life. You're doing this, which is incredibly hard in the most challenging times of all, in a global pandemic. And I want to take a minute to recognize the extraordinary work you have done in absolutely extraordinary times, and hope that you occasionally take a moment to recognize for yourselves what an incredible job you are doing, because there will be days I know that you think you are not. So this time was a complete whirlwind, figuring it out and growing and changing and building a career as I was. Additional things happened. My mentor, David, left our institution to go to University of Colorado, and a new mentor, Dr. Jeff Ginsburg, who is shown here, stepped in and helped me continue along my path and broaden my horizons in team science and looking at how post-genetic responses might help us figure out different types of infectious diseases. And so again, the investment from these mentors was absolutely critical to my success and survival in academics at this part of my career. But we're going to take a break from my story and show that this story is absolutely not unique. Throughout the literature, particularly regarding academic medicine, there is ample evidence that investment from mentors is a good thing. Investment from mentors increases engagement for faculty. So this particular data comes from a very large survey that was done by the AAMC, where they surveyed nearly 12,000 faculty across 26 US medical schools. One surprising piece of data that I found in reading this paper was that only 30% of the surveyed faculty reported having mentoring relationships. I would have hoped that a higher percentage of faculty would report this. But of those faculty who reported having mentoring relationships, compared to faculty who reported not having them, those mentored faculty had higher satisfaction with their role, higher retention rates at their institution, more positive perceptions of their workplace, and additionally, they reported greater productivity than their non-mentored peers. The ever amazing Dr. Rochelle Walensky, while she was chief of the Division of Infectious Diseases at Massachusetts General Hospital, conducted a survey of internal medicine faculty at MGH, of which over 500 faculty responded, and this was regarding mentorship at Mass General. One of the main findings of her study was that faculty who reported having a high quality mentor were 4 times as likely to report strong job satisfaction than faculty who did not endorse having a high quality mentor. And it goes, you can follow from this, although this was not part of their study, that and look at other data, that individuals who have strong job satisfaction often have greater productivity, they have greater retention rates, they make less medical errors, and they have more retention in where they are than faculty who do not share those characteristics. There are similar studies at other institutions, including one from Creighton University, where the data is not shown here, that university investment in a mentoring program for junior faculty members actually increased their 5-year retention rates for young faculty from somewhere in the 20% range to upwards of 50% over 5 years of having the program. But what about what's in it for the mentors? Mentoring takes time and it takes energy. And actually, there are many benefits to mentoring for the mentors in addition to benefits for the mentees. In this particular systematic review of 13 papers on mentoring in medicine, these particular authors found that actually being a mentor was an antidote to burnout for mentors, and it improved their work relationships, it improved their confidence in what they did, it improved their networking skills, and it improved their stress management. This particular graph or table comes from a study that was done and compiled by academic emergency medicine physicians, where they were looking across the literature at benefits for both mentors and the institution in having strong mentoring programs. And you can see here that many of the things listed that are benefits for mentors were found in these other studies. Other things that stood out to me were, interestingly, mentors often had a higher salary and rate of promotion, presumptively because of mentee productivity, improved technical expertise, which kind of made me laugh as I think about how my mentees help me make my slides better, keep me active on Twitter. Pretty soon I'll probably have a TikTok, who only knows, but definitely improved technical expertise, less likely to burn out or plateau, and then recognition and pride in developing the next generation. But there are also benefits for the institution, particularly highlighting improved networking and collaboration nationally for institutions that have strong mentoring programs. So why are we here? Many of us are here because taking pride in educating the next generation of physicians and scientists is something that is core to our academic mission. And the particular themes that are shown on this slide come from qualitative studies, again from the AAMC, where they interviewed a series of academic physicians to find out why people stayed in academic medicine. And again, one of the main themes was people were in academic medicine because of the mentoring and the investment piece in educating the next generation of physicians and scientists. Other themes that were important to academic physicians, including conducting research that was linked to improving patient care and addressing community needs, as well as providing high quality patient care, especially in local communities. And you can see that the work values that are common to each of these and that were themes that came out in this qualitative study: people enjoy the variety and intellectual stimulation, as well as the ability to serve the community, but also it's these fulfilling relationships, this ability to invest, that are things that keep us in academic medicine. And I just pulled two quotes for those of you who are here that are mentors to students and residents and fellows and people that you are investing in. And this is a quote from a young faculty member when asked about why they chose to be in academic medicine. And this particular faculty member said, "I guess you could say every single attending who taught me and everyone who I learned from during my residency were all role models for me. They were in academic medicine. I found my role models in academic medicine." And an additional faculty member, when asked why are they in academic medicine, they reflected on the people that were at the top of their list and thought back to when they were a fourth year medical student and did a specialty rotation and met someone who became my mentor in both residency and fellowship. She was also involved in teaching and I wanted to be like her. And so here at the Master Clinician Lectureship and Visiting Professor, recognizing that what we do in our day-to-day lives has an impact on people, whether it's a formal investing mentorship relationship or it is a more transient one, and certainly has an impact down the road. So back to the story. As you might have guessed, I am no longer an active laboratory investigator, and it's not a common path to take the path that I did. And this is where the introspection part of the team comes into play. And about 6 or 7 years or so into my time in the lab, I began to have a sense that perhaps I was not making an impact in a way that had the most meaning and the most value to me. And I needed to really think about, is this how I want to spend the rest of my career? How can I do the things that I really want to be doing? And I really needed to put myself out there and had several very honest meetings, first with mentors of mine who were not my direct laboratory mentors. And you can see Dr. Andy Ashbaugh here and Dr. Charlie Weiner, who was actually the program director when I was a resident and a chief, and came to the conclusion that where I really wanted to try to make an impact was being back into medical education. And so I needed to have that same honest meeting with the mentors, with David and Jeff and others who had invested in me in my laboratory career. And that introspection paid off because I was able to have these discussions and really learn some very big, important lessons about what it means to truly mentor and truly invest in someone. And I very much believe that the types of mentors that we should all try to be and the mentors that we should seek are the people who are looking to support their mentees along a pathway of success that is defined by what means success to the mentee and not to the mentor. And if that pathway diverges from what you do as a mentor, then you're there to ask the hard questions and to help, challenge assumptions and to ensure that the path is one that is viable, but ultimately to give space and support to the mentees that you're investing in to try something new and something that they perhaps feel is where their path might be. And so, with that and with those introspective conversations, My mentors gave me some space to get to have some time to attend on the general medicine wards again, which was as fun as I remembered, and ultimately to take a small role in the residency training program, all while maintaining my space in the lab. Serendipity helps for sure. And you will know in academic medicine, things are always changing and people are taking on new roles and positions are becoming available and there's changes at the top. And I was one of those people who happened to be, in the right place at the time when a new chair of medicine came to Duke, Dr. Mary Klopman, and ultimately was offered the opportunity to become the program director for the internal medicine program. And this was a clear inflection point. And I want to put out there for many of us, we often don't recognize for ourselves when we are ready to take on a new role. And that might result in us turning down something we're asked to do or not applying for a position when it becomes available and assuming that someone else is more ready than we are. And I want to put out there that, again, trust your mentors. If they think you are ready for something and they ask you to do it, they probably know more than you do. And if it's something that you want, you should trust them and you should take it. And if you're concerned about applying for something because you don't think you're qualified, then let the people on the other side of the application process make that decision, because the most certain way to not get a position is to not apply for that. And so when asked, I would have said, oh gosh, I'd love to be program director, but I should probably wait a few years. The advice from my mentors was take it. And so I did, and absolutely the best decision in my career that I could have possibly made. So took on the position in 2011, as Dr. Wachter said, and have not looked back. And what's down here in the red bar is maybe so, I don't feel as old as potentially I am, that I can still throw around the acronyms that are probably a couple of years out of date. But when you know, and, getting into the role of being program director has been phenomenal, and jumped in and honestly have not looked back for a second. And so here at this point, we're taking a look at inflection points, and I would define an inflection point as that very uncomfortable moment when introspection plus investment can lead to exponential growth. And so as I tracked my career, along these various points, recognizing it's not linear, and these very important times and places that I were have not always been easy, and have sometimes had a lot of stress and introspective thought, but certainly have been fantastic. And what's next? I don't know. When my husband was looking at my slides, he's like, you really shouldn't have everything just stop there. You need some arrows because you're probably not done yet. And so I don't quite know, but I imagine in the future, there will be additional inflection points and time for introspection and investment as I take on new roles and have changes in what I do as well. So at this point, to summarize before we go forward, I think the key feature and what I have learned over time is that ongoing assessment is important. You really want to always be thinking, how can I define my mission? Where indeed do I want to make an impact with the tools that I'm given, at the place that I am, and the time that I have? It's very difficult to be a self-advocate, but self-advocacy is critical. And it's important to take that investment from your mentors and talk with them honestly about what you're thinking, and to always be open to meeting with potentially new connections. Important to find those that will invest in you, cherish them, treasure them, do your best to live up to what they need from you, and be an active participant in each of your mentoring relationships. And then finally, and I mentioned this in the prior slides, opportunities will likely always arise, always before you think that you are ready for them. But trust the people around you, that if they're offering it to you, they see something in you that you may not yet see in yourself. Go ahead. If it's what you want to do, take the leap and make it happen. So at this point, I was approaching my new job as program director with a great deal of intention. I was figuring it out. I was trying to understand how I maintained stability for the residents that were in the program at the time. How could I build on what was a thriving program with a wonderful history and great tradition? And how could I set, my mark on the culture of what we had in the Duke Internal Medicine Residency program? And so the early part of my time as program director was really about creating culture. I firmly believe that people will thrive and do their best and grow into who they need to be if they feel valued, if they know they are appreciated, and that they are able to take on challenges and be connected to something that is much bigger than themselves. And without going into all of the stories of what we did, we worked very hard to establish our Duke family feel, build new traditions, such as the annual Page the Intern Cake and Family Weekend, for our residency families. We worked hard to build new faculty resident connections in the clinical environment, in the research environment, and through community service and social events. And we also worked to build new curriculum with redesigns of our clinics, redesigns of some of our inpatient services, and bringing us into the era of learning health. For me, it was important to find a professional home, and I would encourage everyone to make sure that that is something that they prioritize across their careers. For me, it was engaging in the Association of Program Directors in Internal Medicine, or APTIM, where the connections and relationships that I've developed with fellow program directors across the country have been enjoyable, sustaining, enlightening, and so many other things, and are truly people I have relied on during good times and in the many, many challenges we have all faced throughout the past several years. In addition, being program director allowed me to take on active roles in our medical center that I wasn't able to do prior, and I was able to both participate in and lead teams within our Department of Medicine and also throughout our graduate medical education community. And for all intents and purposes, things were going really well for the first few years of being program director, and it was approached with the best of intention. But as there were things that were happening that were somewhat out of our control, with building of a new wing of the hospital and patient volumes increasing dramatically without an increase in the number of staff to take care of them. Our faculty were incredibly stressed as we implemented Epic, our at that time new electronic health record. And our program was plagued with excessive resident work hours and challenges in maintaining resident caps. Burnout was a very big thing, as well as a big loss of connection amongst our residents and our faculty, and things that were important to us at the time. And so an external force came in to remind us of all of the places that we were not living up to expectations. And at that point, we were faced with, an external ACGME site visit. I know that the ACGME comes in on these site visits so that they can help you make your program better. But I will tell you, at the time, to us, it did not feel that way. To me in particular, it felt like public humiliation. We were stressed, we were embarrassed, we were concerned, and many, many, many other emotions. And we were fortunate enough that our chair trusted us to lead the program and to lead the department through this very challenging time. And at that time, and even after, I drew on the principles that come from this classic Harvard Business Review article that is entitled "In Praise of the Incomplete Leader." And essentially what the authors of this article suggest, after observing multiple leaders in multiple different situations, most of them non-medical, over time, is that there are generally, in their view, 4 major characteristics of leaders. There are the sense makers who can articulate a clear view of the current situation. There are the relators who value the people for who they are before valuing them for what they do. There are the visionaries who can plan a meaningful future that is rooted in the core values of the organization. And there are the inventors who can put ideas into practice. And their theme throughout this article is that any given leader is likely strong in one of these domains, potentially strong in two of these domains, but is highly unlikely to be strong in all of these domains. And where leadership arises when you can become comfortable with your incompleteness, and that you are able to allow others on your team to rise to the occasion and make sure that they are strong in the components where you are less so. And I would say that my definite strength among these four is in the relating piece, and I have a bit of strength in visioning, but I need it, and I definitely did not have strength in delegating, which was not one of the four characteristics that they mentioned. But through what at the time was the biggest crisis that we had faced, and I would say we have certainly faced far bigger crises since the time of the ACGME site visit, including loss of graduates of our program to suicide, the global pandemic, reckoning with systemic racism and societal breakdown, all of those far bigger challenges than an ACGME site visit. Being able to understand what it means to be incomplete and how one can let others lead really got us through each of those very difficult times. And so persevere we did. And we went through a very intentional reset of our program at the time of the ACGME site visit. A big, no ego. This is, assessment of what we were doing right and what we were doing wrong. And I vividly remember needing to stand up in front of the entire department at our State of the Residency program grand rounds, in a call to action and accountability of what was happening and how we needed to move forward to reset our residency training program. We went back to our core values and reestablished our why, and that major connection and investment between trainees and faculty, and the shared values of recognizing that everyone in our program needed to be known for who they are and what they brought to the table, and that was valued, and that we needed them to be here and to be engaged. And this assessment allowed us to ask for new things and to develop new coverage models. There were important paradigm shifts in how we did things, the biggest of which was helping people recognize that every single patient who came through Duke Hospital did not need an internal medicine resident participating in their care. The volumes were too much and we needed to restructure. We asked for new resources, we set up new services, and we started to do things in very different ways on the ground. Importantly, we developed a culture that systematically evaluated our outcomes, recognized when changes were good, when changes weren't having the desired outcome, and how to move on and how to change things once again. And so we are going to move in this talk now to some stories of inspiration. And I will say that, on the heels of what at the time was the greatest professional challenge that I had faced, resetting our program from this very public ACGME visit, we came upon what was the greatest, and hopefully the greatest going forward, personal challenge. Because a couple years after the site visit, my husband, as I mentioned earlier, was diagnosed with acute myelogenous leukemia. And while obviously this is not something that you plan for, and as physicians out there, you all know this is the type of illness where, just like in his case, he was fine. And then we thought he had some sort of viral something. And yes, I am an infectious diseases doctor, and I don't know what you have, but something will get better, kind of thing for a couple of weeks, which then transpired into not being fine a couple of weeks later. a horrific looking CBC, a bone marrow biopsy, and then admission to the hematologic malignancy service, all within a very, very short order. And I had to go back and draw on all of those leadership lessons that I had learned in my time as program director in order to try to lead not only, our family, but myself and our team, through this health crisis that we were facing. And there I was like the wife with the notebook, trying to make the treatment decisions and plan and, do all of these things. And, so many lessons learned throughout that time. And while things are totally fine now, I will highlight a couple of pieces of what my family and those around us did during that time in relation, to being, the incomplete leaders that we are. You can see my husband here. This is pre-chemo. He's about to get 73, and he's a sense maker. And so he was there doing exactly what he would extol his patients to do as a lung transplant physician, which was get out of bed every single day and be active. So you can see him and Jake like in little room on the heme malignancy floor, wearing masks before masks were cool or before they were a cultural flashpoint. He's on the bike and Jake's keeping up there on the treadmill. Jonah's the visioner, and he just had optimism, sort of throughout the whole thing. And so he just kept us all going. I, in my relating, decided to write. And so writing is what kept me going throughout all of this. And we ended up, putting it onto one of those websites that you have when someone is sick so that you can keep everyone, abreast of what's happening. And so writing on Caring Bridge became the lifeline for me during this time. But what I learned as a leader was how unexpectedly important being transparent and showing vulnerability and being intentional in what we put out there, how important that was to all the people who cared about us and important to the people whose education and career development was still entrusted to me. And so, in all of this, I think one of the other important lessons that I learned is how much showing vulnerability is important in leadership and ensuring that the people around us know that everything is not always easy, isn't going as well as you might have expected it to, and we don't have, the Instagram life, that there are real challenges out there and that we are real people. Jake just did his thing and, was really out there as the inventor, just showing people what could be done, and as, not wanting recognition for being the bone marrow donor and saying, anyone would do in my shoes what they would do. I have this picture on here of our Dave and myself. You can see him here bald, as well as many of our residency friends and mentors climbing the Hopkins Dome, at the end of Dave's release from his bone marrow transplant, just illustrating the relationships that can be sustained over time during times of crisis. And I will say that there are many, many physicians out there who have used this principle of showing who they are as a whole person and vulnerability as part of their investment in leadership. And in the corner here, I will call attention to a colleague of mine, Dr. Marie Carlson, who wrote what has become an award-winning JAMA Piece of My Mind. If you haven't read it, I would absolutely say that I think her essay should be required reading for anyone who is involved in healthcare. But without giving away, the whole thing, Marie herself, has had serious illness affect her in her adult life. And in this particular essay, she writes about a time where, as a result of her illness, she finds herself in the emergency department encountering the orthopedics trauma resident who was a former medical student on her general medicine team at the Durham VA. And as it turns out in their conversation, it becomes very clear that it wasn't the lectures on diabetes management or anemia or all those other chalk talks, which stuck with this student, now resident, over time, but some of the other human things that they shared in that interstitial conversation that happens when you're working together on a ward team. And she concludes with, I came to realize that, the things that I teach weren't necessarily what I actually thought that they were. Inspiration can come, from many, many different places. And I will call out two of our former chief residents who actually used their place in our residency program and at Duke to actually meaningfully change the culture and inspire others. So it's a tradition at Duke that chief residents each give a grand rounds at the end of their chief resident year. And most often this grand rounds will be on a medical topic of their interest, or perhaps, the research that they're going to take on. And so Dr. Mahadige took her time to actually inspire us with with bringing forth what was microaggressions and incivility in the environment. And she, through her grand rounds, revolutionary at the time, was actually able to inspire our faculty to get training in restorative justice to debrief microaggressions in the clinical environment at Duke. And Dr. Wegerman, just 2 years later, member of a dual physician family herself, was able to articulate the reasons why leave for both birth parents and non-birth parents was important, and actually affect the timing and payment of leave for our residents in our program. Inspiration comes again in many, many other ways, and I will call out individuals both here and from our program who've been able to inspire through the platform of social media. I want to give special highlight to Dr. Justin Bullock, someone who I've never met in person, but I feel like I know him through social media, and how he has used his platform to inspire others and be vulnerable and actually show that it's okay to be a physician who also has illness. I have no doubt that Justin's work on Twitter and in other spaces has likely saved someone's life, as well as call out the great tradition of clinical problem solving that comes from UCSF, and how Drs. Ravi Jehat and Reza Manesh have been able to inspire others to actually be okay saying, I don't know, and now have a global following who are disciples of their clinical research. And so to end things, I will go with a line from a poem called Turning to One Another, and then I hope that we all treasure curiosity over certainty. I know we're all looking for a map that will get us directly to where we want to go, avoiding all of the obstacles. But I think what really happens is that we have this winding path with these points of confusion and with inflection points along the way. And that when we tell our story, we're probably doing this backwards linear regression to make it seem like perhaps we had it all figured out in the first place. And so as we close, I want you to think about, who is in your team, build connections with them. Think about 2 people who have invested in you, and commit that at some time in the coming weeks, you will tell them thank you. Think about people who have inspired you, whether they're here locally or you don't even know them, and commit to letting them know. And so in final thoughts, I want to say thank you to Dr. Gurpreet Dhaliwal and the UCSF Master Clinicians, and to the entire Department of Medicine, and as well to everyone who has inspired and guided me and others across my time, and those who continually inspire others to be the best versions of themselves. Thank you all so much.
Thank you, Amy. That was terrific. We'll go over for a couple of minutes. Appreciate the breadth of the material you covered, and your honesty and vulnerability is inspiring. How do you decide about sharing versus oversharing, particularly in a world of social media and Twitter and all those sort of things? We all sort of need some boundaries. You've made a decision to be quite open about your husband's illness, but I think that comes up a lot as people get sick or have family illnesses, trying to figure out how to draw that line. So how did you think about that?
Yeah, that is a great question. And it's a hard one because I think, my colleague explains it best. It's like it's okay to be vulnerable. It's not okay to be leaky. And so kind of recognizing, where you are and how much you share and who you're sharing it with requires, some intentionality about, yes, it's important for you to know that I'm not going to be here, all the time, and that this is tremendously challenging. It's not necessarily important for the residents to know, in past tense, a fight that my husband and I might have had about like who's going to do what, with something, for the kids, or things like that. And so, I think it's a continual assessment, not always without mistakes, about, sharing versus oversharing. And I definitely think this all happened in sort of my pre-Twitter phase, and so now, I think a lot about what do I share there, if there's, how do you engage in conversations about what's happening in the world with, and that type of thing, maintaining, some level of things to yourself. But I think it just requires constant reassessment.
Mm-hmm. When you talked about sort of your leadership journey, which sounded like a moderate amount of serendipity and people recognizing how good you were and plucking you. Now you give a lot of advice to young students, trainees, faculty, probably a fair number of whom covet a job that's sort of like yours. Do you tell them just sort of trust serendipity, or do you tell them be intentional about how to position yourself? And then if one's goal is to be a leader in the educational space, how should they be positioning themselves?
That is a great question. And I think things are changing a bit in that more positions have an application process than just sort of this like, being tapped, from on high to do things, which I think is a good thing, but that was definitely not my experience. And so, talk about, understanding what you really love, and that there will be points where you don't want to be taken advantage of, but you need to, as you said, position yourself to be recognized. And so if you want to be a clinician educator, don't just volunteer all of your time to do every single lecture that's out there. But if you're going to be volunteer to do some. Mm-hmm. And if you're going to be working with students and residents, make sure that you try to divest of some other responsibilities and you really put yourself all in and take and be the, get feedback and figure out how to learn how to do it really well, because people then will see you for where your strengths are, and you will get asked to do things. And don't be afraid to put your name in the hat for something that you're interested in. And if you don't get it, use that as a learning experience and figure out, and grow from that so that you can do it, the next time that it comes around.
Great. Maybe my last question is I had a very similar experience to you. I started out as 80% research and then realized I wasn't that good at it and didn't love it as much as I liked medical education, and ultimately became residency director here a long, long time ago. But I remember a feeling of disappointment in myself and a little bit of failure. And I think at the time, that I had the job that people were supposed to want to have, having a lot of protected time to do research. So how did you manage the idea of, you probably weren't used to not succeeding in a whole lot of things to get to where you were at that stage? And here you're on this research path and you're making a decision to leave that path. How did you manage that?
Yeah, I'm probably rose-colored, glassesing it a bit, looking back, it was very hard. Part of it is, are you disappointing yourself? Part of it is, are you disappointing, the people who have invested in you? And, what is their vision, of you? And do you want to keep, upholding that? And so I had to have a few people, kind of I went to people outside of the institution, for advice, at that point, which was very helpful because it didn't matter to them what I chose, it wasn't going to affect them, in any great way. And ultimately, Charlie was like, are you building your career to make other people happy? or are you building your career so that you can be happy with what you're doing? I was like, all right,
The right question. I assume you've used that line on with many other people. So just shows one of the values of mentorship is that he mentored you, and then you said that worked for me, and it becomes it scales.
Yes, 100%. I've told everyone all along I want to be a cardiologist. I don't think I like cardiology. What do I do? I'm like, well, when you're a cardiologist 15 years from now, do you think your mentors are going to do they want you to be unhappy? Are they going to want you to be an unhappy cardiologist or a happy nephrologist? And so, that kind of framing hopefully is helpful. It was definitely helpful to me.
Great. We're a little bit over time, so we need to quit. And thank you so much for being here and for a terrific talk, and look forward to the rest of your visit with us. Really appreciate it.